Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we are going to learn about ectopic pregnancy. Let's get started. Let's see about what an ectopic pregnancy means. It happens when a fertilized ovum implants outside the uterine cavity. Second, we will see why this is important. It is a life-threatening condition for the mother because there is a high risk of tubal rupture and severe hemorrhage. Now we will see about how common it is. An ectopic pregnancy accounts for about 1 to 2% of all pregnancies. Let's see about the common sites of an ectopic pregnancy. Most ectopic pregnancies occur in the fallopian tube, which accounts for about 95% of cases. Within the tube, the ampullary region is the most frequent site, followed by the isthmic, fimbrial, and interstitial or cornual areas. There are also less common locations, such as the ovary and the cervix, each making up around 1%. Very rarely, an ectopic pregnancy can occur in the abdominal cavity. Another important and emerging site is the cesarean scar, which can be dangerous and needs early recognition. Next, we will see about the risk factors for an ectopic pregnancy. A woman who has had a previous ectopic pregnancy is at a higher chance of having it again. Any kind of tubal surgery, like ligation or reconstruction, can also increase the risk because it may affect the normal movement of the egg. Endometriosis is another factor, where the lining of the uterus starts growing outside the uterus and can interfere with the tubes. Assisted reproductive techniques, like IVF, may also raise the chances. The use of an IUCD, especially if a pregnancy occurs while it is in place, is another risk. Smoking is also known to affect the function of the fallopian tubes, making ectopic pregnancy more likely. Let us see about the pathophysiology of ectopic pregnancy in a simple way. Normally, after fertilization in the fallopian tube, the embryo slowly moves down into the uterus when it should implant. In an ectopic pregnancy, this movement is disturbed. The tube may not push the embryo forward properly because of impaired tubal motility, for example, due to scarring or damage. As a result, the embryo gets stuck and implants in the tube itself instead of the uterus. Once it implants, the trophoblast, which is the outer layer of the embryo that normally forms the placenta, starts to grow into the wall of the fallopian tube. The tube is thin and not designed to stretch like the uterus. As the trophoblast grows, it erodes or eats into the nearby blood vessels. This causes bleeding inside the tube. With time, the pressure of the growing pregnancy and the ongoing bleeding can become too much for the tube to handle, and the tube may finally tear or rupture. This tubal rupture usually happens around 6 to 10 weeks of pregnancy and leads to sudden, severe internal bleeding, which is why ectopic pregnancy is a medical emergency. Over time, the pressure from the growing pregnancy and the bleeding becomes too much for the tube to handle. Finally, the tube may burst, causing a tubal rupture. This is dangerous because it leads to sudden, severe internal bleeding and becomes a medical emergency. Let's see about the clinical features of an ectopic pregnancy. In the early stages, the symptoms are often mild and can easily be confused with a normal pregnancy or a minor abdominal problem. A missed period is usually the first sign. Some women may notice mild abdominal or pelvic pain, which can come and go. Light vaginal spotting may also occur, which is different from a normal period and often appears as brownish or slight bleeding. If the ectopic pregnancy ruptures, the symptoms become much more serious and appear suddenly. There may be intense, sharp lower abdominal pain. Some women experience shoulder tip pain, which happens because the internal bleeding irritates the diaphragm, and the pain is felt in the shoulder. Heavy vaginal bleeding may start. As internal bleeding increases, signs of shock can appear, such as a fast heart rate, low blood pressure, dizziness, or even fainting. These symptoms indicate a medical emergency and need immediate treatment. Let's see about the signs that suggest an ectopic pregnancy has ruptured. When the fallopian tube bursts, there is sudden internal bleeding, and the body quickly starts showing warning signs. One of the earliest signs is hypotension, which means low blood pressure. This happens because the body is losing blood internally. At the same time, the heart starts beating faster to compensate, leading to tachycardia. As bleeding continues, the abdomen may become distended or swollen due to the collection of blood inside the abdominal cavity. On physical examination, a tender adnexal mass may be felt, which means there is pain and tenderness near the ovary or fallopian tube area. These signs indicate a medical emergency, and immediate treatment is needed to save the patient's life. Let's see about how an ectopic pregnancy is diagnosed. The first step is usually a urine or serum beta-HCG test. In a normal pregnancy, this hormone rises quickly, but in an ectopic pregnancy, the levels may be positive, but rise slowly or stay low. This gives an early clue. A transvaginal ultrasound is the most important investigation. It may show an empty uterus when a pregnancy should normally be seen, and at the same time it may reveal an adnexal mass near the fallopian tube or ovary, suggesting an ectopic implantation. Choledocentesis, although not commonly used today, is a procedure where a needle is inserted into the space behind the uterus to check for free blood. If blood is present, it may indicate internal bleeding from a ruptured ectopic pregnancy. Laparoscopy is another useful tool. It allows the doctor to directly view the pelvic organs, confirm the diagnosis, and at the same time treat the ectopic pregnancy if needed. This makes it both a diagnostic and therapeutic procedure. Let's see about how an ectopic pregnancy is managed. The treatment depends on the condition of the patient and whether the ectopic pregnancy has ruptured or not. In cases where the ectopic pregnancy is stable and has not ruptured, medical management can be used. Methotrexate is the most commonly used medicine. It helps to medically terminate the ectopic pregnancy by stopping the growth of trophoblastic cells, which are the cells that support the developing embryo. This allows the pregnancy tissue to slowly shrink and get absorbed by the body. If the pregnancy is not suitable for medical management, or if the condition is unstable, surgical treatment is needed. One option is salpingostomy, where the fallopian tube is opened and the pregnancy tissue is removed while preserving the tube. Another option is salpingectomy, where the affected fallopian tube is removed completely. This is usually done when the tube is badly damaged. In cases of a ruptured ectopic pregnancy, emergency surgery is required immediately to control bleeding and save the patient's life. Let's see about the complications of an ectopic pregnancy. One of the most serious complications is hemorrhagic shock. This happens when the fallopian tube ruptures and causes severe internal bleeding, leading to dangerously low blood pressure and poor blood flow to vital organs. Tubal rupture itself is a major complication, as it can occur suddenly and requires immediate emergency treatment. Another important complication is subfertility. Damage to the fallopian tube or removal of the tube can reduce a woman's chances of becoming pregnant in the future. There is also a risk of recurrent ectopic pregnancy, which means that once a woman has had an ectopic pregnancy, she has a higher chance of experiencing it again in later pregnancies. These complications highlight the importance of early diagnosis and timely treatment. Let's see about the ways we can help prevent ectopic pregnancy. One important step is the early treatment of sexually transmitted infections, especially those that can damage the fallopian tubes if left untreated. Quitting smoking is another key measure, as smoking affects tubal motility and increases the risk of ectopic pregnancy. Safe reproductive health practices, such as using protection and planning pregnancies carefully, also play a big role in reducing risk. For women undergoing assisted reproductive technologies, like IVF, Careful evaluation and monitoring during the procedures can help detect any problems early and reduce the chances of an ectopic implantation. These preventive steps together can help protect reproductive health and reduce the risk of ectopic pregnancy. Let's see about how an ectopic pregnancy is managed according to the clinical situation. Once an ectopic pregnancy is confirmed, the next step is to decide which management approach is safest for the patient. In some cases, expectant management can be used. This is chosen when the woman has no symptoms, the HCG levels are naturally decreasing, and there is no sign of rupture. In this approach, the pregnancy is monitored closely without active intervention. Medical management with methotrexate is selected when the patient is hemodynamically stable. The HCG level is below 5,000 IU per liter. There is no fetal cardiac activity, and the ectopic mass is small, usually less than 3.5 centimeters. Methotrexate helps stop the growth of the pregnancy tissue, so the body can absorb it. If these conditions are not met, or if the patient's condition is unstable, surgical management becomes necessary. When there is evidence of rupture or heavy internal bleeding, emergency surgery is performed immediately to control bleeding and remove the ectopic pregnancy. This step is crucial to save the patient's life. Let's see about expectant management in ectopic pregnancy. This approach is chosen only when the patient has no symptoms and is clinically stable. It is usually considered when the body itself is already resolving the ectopic pregnancy. One of the key signs is that the beta HCG levels are naturally decreasing on their own, showing that the pregnancy tissue is shrinking without intervention. Another important requirement is that there must be no signs of tubal rupture or internal bleeding. In expectant management, the patient is closely monitored with repeated HCG tests and ultrasounds to ensure the pregnancy continues to resolve safely. This method avoids medication and surgery, but it requires careful follow-up. Let's see about medical management using methotrexate. This option is chosen only when the patient is hemodynamically stable, meaning her vital signs are normal, and she is not showing signs of internal bleeding. It works best when the HCG level is less than 5,000 IU per liter. Another important requirement is that there should be no fetal cardiac activity, because methotrexate is not effective when the embryo has a heartbeat. The ectopic mass should also be small, usually less than 3.5 centimeters, and it must be unruptured. Methotrexate works as a folic acid antagonist. This means it blocks folic acid, which is needed for trophoblastic cells to divide and grow. By stopping this cell division, the ectopic pregnancy tissue gradually shrinks and gets absorbed by the body. Follow-up is very important in this method. The beta HCG level is checked again on day 4 and day 7 after the injection. A level should drop by at least 15% between these days. If the drop is adequate, the treatment is considered successful. If not, another dose or a different method may be needed. Let's see about surgical management in ectopic pregnancy. Surgery is chosen when medical treatment is not suitable, when the ectopic mass is large, or when there is active bleeding. One common procedure is laparoscopic salpingostomy. In this method, the surgeon makes a small cut on the fallopian tube and removes the pregnancy tissue, while keeping the tube intact. This helps preserve fertility when the tube is still healthy. Another option is laparoscopic salpingectomy, where the entire fallopian tube is removed. This is preferred when the tube is already badly damaged, when bleeding is present, or when preserving the tube may risk future complications. Removing the tube ensures all ectopic tissue is taken out safely. Emergency surgery is required when the ectopic pregnancy has ruptured. In this situation, there is internal bleeding, and immediate surgical intervention is necessary to stop the bleeding, remove the ectopic pregnancy, and stabilize the patient. This is a life-saving procedure and must be done without delay. Let's see about the key nursing responsibilities when caring for a patient with an ectopic pregnancy. The first priority is to assess the patient's hemodynamic status. This means keeping a close watch on vital signs such as blood pressure, pulse, and breathing to detect any signs of shock or internal bleeding. Nurses also need to monitor the patient's pain level and watch for any increase in vaginal bleeding, which could indicate worsening of the condition. Providing emotional support is very important, as the diagnosis of an ectopic pregnancy can be emotionally distressing for the patient and her family. Nurses play a crucial role in offering reassurance, listening, and guiding the patient through the treatment process. In cases requiring surgery, nurses provide both preoperative and postoperative care. This includes preparing the patient for the procedure, ensuring consent, monitoring recovery, managing pain, and preventing complications. If the patient is receiving methotrexate, nurses must educate her about the medication, including precautions such as avoiding folic acid supplements, avoiding alcohol, and recognizing signs of complications. Follow-up is essential to check the beta-HCG levels regularly until they return to normal. Lastly, nurses offer counseling on future fertility and contraception, helping the patient understand her reproductive options and how to plan safely for future pregnancies. That brings us to the end of today's session on ectopic pregnancy. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.